Mayor Krisel, how many cases of COVID do you have in your city? And what have you been doing?
I would like to give you an idea where Tabaco is. Okay, Tabaco is in the Luzon Island, and we are just like 10 to 12 hours away from Metro Manila. Okay, so we're very accessible. And to date, I think we have more than 4,000 locally stranded workers from all over NCR coming back to Tabaco. So the picture in Tabaco is quite different from Ojongan or from Dinagat Island. Most probably similar to Congresswoman Sheila's situation in Marikina. No? We now have 45 cases. But of the 45 cases, 26 have recovered. And so we are now just looking at around 14, 16 cases that are mild and asymptomatic, just trying to finish the 14-day quarantine. We are very blessed that we don't have critical cases at all. So we're very blessed to have those. And we have noticed that most of our positive cases are in the working age group. They are young, in their 20s, 30s, and 40s. So again, that would tell us that the infection is happening now in the workplace. Okay, and then the spread is not just in the workplace, but they bring them home. Okay, so what did we do in Tabaco? When the first cases started, I think early April, we only had 3 cases. We only had 3 cases. And the first thing we did was to really create a communication plan because everyone was afraid. What is going to happen? We don't understand. This is an invisible enemy. And so I think I come from a line of teachers, public school teachers. And so most probably I was able to tell them a story, tell them a story of how we in Tabaco can prevent the spread of the virus. And very easily, it's just 1, 2, 3. No? It is 1, wear your face mask because you protect yourself and other people. Now we added the face shield and of course social distancing of more than 1 meter. The minimum health requirements as a nurse, na medyo gamay ko yon, that I'm comfortable dealing with those things, frequent hand washing, don't touch your face, change your clothes when soiled before you enter your home from outside, all these things. No? So madali, and then most probably since they know I'm a nurse, so medyo alam nila na, alam niya ni Mayor, kaya alam niya kung anong sinasabi niya. I admit I don't know much about COVID. And so I always ask questions. And makulit talaga ako in asking questions because I want to understand and then I want to simplify this complex to something that can be understood. I maximize the use of infographics, information with designs, with figures and graphics. My daughter is helping me. She is an animation graduate of LaSalle, and so she's now helping me with my advertisement using all the tarpaulin and then the internet in really just addressing the lack of information or the misinformation that is happening. Kaya nga natatakot yung mga tao. Tama si Mayor Trina, she's so right that it's two-pronged. You have to take care of the health and then you have to take care of livelihood. No? Sa health, hindi lang yung health ng mga pumapasok, pero yung mga naandito. And so, since palagay ko, I have been doing this even before the crisis, really having specific programs for special groups, like for the senior citizens, we have a special program for them. We have a feeding program for them as well. We also have a feeding program for our malnourished, focusing on the stunted because that's irreversible. And then we have a program also for the PWDs. And I'm very happy to also share with you, we have a very strong program on mental health. Because mental health is really a big thing. Now, with all of these stressors happening to us, it is not just the physical well-being that we need to address, but also the emotional and mental health well-being of our constituents. And we're very blessed because here in Tabaco, we have Brothers of Charity. And Brothers of Charity have very strong programs, I think spanning more than 10 years now, partnering with our LGU on mental health. And so Mayor Trina has already said this earlier, that she is big on rules. I am also big on rules, no? But the problem is, ang laki ng population namin. We are 140,000, and we are in the center of the district, which means that we cater daytime population can be around 200 plus thousand. So yun ang big challenge talaga. So how do you address this? So what I did as the head of the area development team, now composed of 6 LGUs, we had a unified plan with all the other mayors. So collaboration is really key to the first district, because hindi lang siya rules ng Tabaco, but it is adopted and implemented throughout the first district of Albay. So the great collaboration and cooperation really has prevented the spread of the infection. So sinasabi ko mayabang ako, no? In the beginning, 3 cases, just 3 cases. And then 2.5 months, no case at all. And then the president said, balik na lahat ng mga LSIs. And so we are inclusive, and we want to take care of our constituents who are stranded outside. No? So we took them back. And that's when the cases started to rise. No? To be on the rise, but it's isolate, no? And then not everyone can be swabbed. Not everyone can be swabbed. And so what we do is we just quarantine them for 14 days. So talaga strict quarantine lang, because the virus will look for someone. Pag infected ka na, hindi na interesado sa'yo si virus. Hahanap na siya ng iba, and then magda-die na lang siya a natural death pag wala siyang mapuntahan na bagong host. And so the quarantine and the isolation is very important, and we teach that to people so that they can count. How many more days ako? Okay, from the time you are swabbed, no, you count 14 days with or without symptoms. And then we release you if you have 3 days no symptoms at all. Okay, so kasabay namin siya. We're now partnering with our clients. And Marites, I'd like to share also that tinatawagan ko sila. I call them, and I want them to feel that the LGU is here. This is my number. If you have any problems, if you have any questions, please let me know. Almost everyone knows my number. They can call me anytime. They can communicate through our 24-hour command center. And I think just knowing that they can talk to someone, and they can talk to the mayor anytime or text her anytime, and she will answer back. I think that gives you confidence, no, to also participate, no, in fighting this pandemic. Those are very simple strategies, actually, no? Just communication, and it's two-way. Not just us communicating to the people, but also getting their feedback so that we can serve them better and know their needs. But the things in livelihood, just like Mayor Trina, we have face masks, and then we're now attempting to do this, abaca face masks, because they say abaca fiber has more, is better, no? In it's less porous. It's less porous. So since abaca producer po kami dito sa Bicol region, so we are now venturing into making abaca face masks. And hindi lang siya, Congresswoman, baka po pwede sa House of Representatives together with Congressman Lagman, we can now make face masks for the higher end clientele, no? Abaca face masks that are more and more can give you more protection, and social ka pa. So yun ang mga iniisip namin. We were really innovating so that we can maximize, no, the livelihood opportunities for our people during this pandemic.